Oftentimes, the first time people learn they have heart disease, it can already be too late.
By the time their massive heart attack is over, they may not survive, even though there were no warning signs. As many of you know, our senior investigative reporter Matthew Simon was lucky to survive his massive heart attack caused by a genetic condition. As we continue this heart-to-heart conversation, what many of you might not know, Matthew included, is that there's been a quick, cheap heart test that could save your life right here in our community for decades.
It's in our agreement, I have to laugh.
A new Big Bang, CBS next Thursday.
Chances are pretty good.
One box.
You may know Wausau DJ Ken Bishop's voice.
Marvel Studios presents.
And when he's outside of his West Side home studio,
this is the therapy bike.
Biking is his escape, but the therapy he talks about has a deeper meaning.
The night before my heart attack, I was out on a 12-mile ride, and my son was in front of me. He was 14 at the time, and we're just less than a mile away, and I ride 20, 30 miles at a time, and I had to stop, get off my bike, and walk and say, "Hey, Jack, wait up. I need to walk." Right then and there, I knew something was drastically wrong.
By the next day, he had open heart surgery to save his life. His triple bypass a shock, because 49 years old at the time, he considered himself healthy, even though he knew his dad had had heart disease for more than a decade, and he had had some slight chest pain for about a year. Bishop did not consider genetics.
From the time she said, "You're having a cardiac event," I said, that can't be happening to me. I'm 49 years old. I'm the picture of health if you look at me from the outside. But on the inside, there was something drastically wrong I never would have thought was happening. It blindsided me.
And then recovering, watching TV one night, a documentary pointed out a heart scan this massive heart attack survivor never knew about.
And I heard about that, and I thought, wow, that's really interesting. It's affordable. Where was that when I started to experience that angina pain?
It's called a coronary calcium scan. Using special software, a CAT scan can show you if you're having any calcium buildup on your heart. Even if you have no obvious symptoms, doctors say if your family has heart disease, this can be an early predictor whether you're in trouble. What looks like bone is actually calcium, which is an indicator of plaque that causes heart disease and attacks.
Where you have a strong family history of heart disease, or you have maybe just one risk factor and you're wondering about whether this process might be occurring, the calcium scan can be a nice look upstream into that plaque.
From here at Aspirus to Marshfield Clinic, even Ascension, all three hospitals in the Wausau area have this test, and it doesn't even require insurance. It's $99 out of pocket, and you don't even need a doctor to sign off.
It is fairly cheap. In the scheme of things, $100, $150, wherever, that's a pretty cheap investment.
Aspirus cardiologist Dr. David Murdoch is passionate about the preventative heart scan because ultimately heart disease kills every other person in the country.
Yeah, you have high cholesterol, you have high blood pressure. That increases your risk for this problem. The coronary calcium score tells whether you have the problem or not.
That is done through a scoring system. 0 means no disease identified. 1 to 99 is mild. 100 to 399, moderate. Anything above 400 is considered severe.
This would be an alarming situation. We would immediately look to see whether any of this has gotten to the point of being obstructive.
Since 1996, studies have consistently shown this screening can be a good indicator of a problem, especially for people who have no symptoms, but risk factors like family history. In one of those studies, as many as 40% of people tested did not have any symptoms, but were in the severe risk category and were not being treated. And young people are not immune.
The average age of the heart attack in the United States is 65 years old, but 10% of those are in 45-year-olds and younger. And interesting, most of these are men. So I would say having a young male, less than 45, have a heart attack isn't exactly rare. entity. I've seen several people with this.
One of my patients had a triple vessel bypass at age 11. We see heart disease at a young age all the time in this area. A strong family history is one of the strongest risk factors.
And knowing that, continuing to move forward, that is shaping the way Ken Bishop is now talking to his sons about their health.
When they get older, you know, maybe in the next decade or so, I would highly recommend you guys need to have that scan, have a check, you know, see where you're at. To have that accurate of a predictor where you can actually see it, you know, that's amazing.
In Wausau, Matthew Simon.
Peace of mind, you know, that's a lot of peace of mind.
News Channel 7.
Through the years, radiation risk was the medical community's biggest heart scan concern, something both doctors we spoke to say today is now at safe levels, just about the same as a mammogram or a chest x-ray. The doctors say if you have no risk or already know you have a very high risk, then this test is not for you. But especially if you have a family history of heart disease or abnormal blood fat levels, this test can help you figure out a plan with your doctor. The score provides a 5-year outlook on your likelihood of having a cardiac event. Our coverage continues live online and on our mobile app now, where you can watch our complete series, including Dr. Murdoch's full discussion with Matthew Simon about the heart scan.